Assalamu alaikum everybody. Welcome back to my Principles of Pharmacology. In today's presentation, inshallah, we'll continue talking about drug treatment of mental disorders. This is the second presentation where we'll discuss the anxiolytics in details, especially the pharmacokinetics of the benzodiazepines. So the main goals of this presentation is first to know what are the types of drugs used in treatment of neurosis. This would include the antidepressants, antipsychotics, and the anxiolytics. We also will discuss the classification of the anxiolytics in details, including the benzodiazepines and the non-benzodiazepines like the azapirons. Lastly, in details, we'll discuss the pharmacokinetics of the benzodiazepines. So first, what are the different types of treatment of neurotic illnesses? What are the different types of treatment of neurotic diseases or disorder? Usually, there are two types mainly. The first type is known as non-drug therapy. Non-drug therapy nowadays is very important method of treatment of neurotic illnesses. This involves, for example, psychotherapy, different types of psychotherapy like behavioral modification therapies, etc. And as well, it involves electroconvulsive therapy. Electroconvulsive therapy. This is non-drug therapy. It is out of the scope of our lecture, and our main objectives is to know the drug therapy of neurotic illnesses. Drug therapy of neurotic illnesses. Usually, drugs which are used in treatment of neurosis or neurotic illnesses, usually they are either known as approved drugs. Approved drugs. With approved drugs, they are drugs which are given the license for clinical application by the drug authority. For example, by the FDA in the United States and by the EMA in Europe. So these are the drug authorities which gives the permission of clinical use of drugs. So this is known as approved application. There is another drugs which are not given the approval by the general drug authorities, but they are still used for certain purposes. This use is known as off-label use. It's known as off-label use. Off-label. Yani they are not approved by the drug authority. So usually drug therapy of neurosis, either they are approved therapy or off-label therapy. The first group we are going to talk about briefly now, and then we will talk about them in details when we come to talk about this group are the antidepressants. Antidepressants, they are used for treatment of depression, as we know. So we'll talk about them in details in the future, inshallah. The antidepressants, usually they are reserved to states which are known as neuroticism. Neuroticism is a severe form of neurotic illnesses accompanied by tendency of depressed mood. The mood of the person is depressed. حزن يعني. Depressed mood. Okay? You have the antidepressant in this case. Therefore, antidepressant in this case, they are used in neurotic illnesses, which is accompanied by depressed mood. There are many, of course, drugs which are used in this case. Some of them they are approved drugs, or some of them they are off-label. Maybe I will mention one or two. First, are known as selective serotonin uptake inhibitors. Selective serotonin uptake inhibitors. Inshallah, inhibitors. Inshallah, we'll talk about this group of drugs when we talk about the antidepressants. These are known, abbreviated as SSRI. SSRI, or selective serotonin reuptake inhibitor. The most famous example is fluoxetine. Okay? All we have to know now that antidepressants, they have a place in the treatment of neurosis, especially in state of neuroticism, in which there is a neurotic illness or GAD accompanied by depressed mood. Most approved drugs are the selective serotonin uptake inhibitors like fluoxetine. Okay? This is the first group of drug therapy. Second group are the antipsychotics. Antipsychotics. And from their name, antipsychotics are drugs which are used for treatment of psychosis. They are used for the treatment of psychosis, as we have said. So we will talk about the details of these drugs when we come to the treatment of psychotic illnesses. The most famous example is trifluoperazine. Trifluoperazine. This drug, trifluoperazine. This drug is approved by the FDA for the treatment of certain types of anxiety. Of course, antipsychotics will be helpful in cases where there is a neurotic illness accompanied by hallucination and delusion. In very rare cases, we have said that neurotic illness, there might be accompanied by hallucination and delusions. So في الحالة هذه, of course, the antipsychotic will be highly effective. We'll talk about the details of antipsychotics lately, inshallah, when we talk about treatment of psychosis. The third group of drugs which are used for treatment of neurotic illnesses are the anxiolytics. They are specific drugs for treatment of anxiety. Anxiolytics. For anxiolytics, there are specifically many of them drugs which are approved for the treatment of anxiety disorder. And this will be the main group which we will discuss, inshallah, in the next minutes. Okay? Anxiolytics. What does it mean, anxiolytics? Anxiolytics, they are drugs which are used to treat anxiety, to provide calmness to the patient, to decrease the fear with apprehension, to give feeling of calm. Anxiolytics, actually, their old name were minor tranquilizers. Lakin, it is an old name which is not used anymore. This is used to differentiate them from the major tranquilizers, which are the antipsychotics. Lakin, they are not used anymore. Anxiolytics can be one of two types. The first type is known as sedative hypnotic anxiolytics. Sedative hypnotic anxiolytics. And these drugs are known as sedative hypnotic anxiolytics because they can produce sedation, plus in enough dose they can produce hypnosis. نوم. Sedation معناها تركين. Hypnosis معناها نوم. And as well, in low doses, they can reduce anxiolytic effect. They can decrease anxiety. Maybe the most famous old example was the barbiturates. We talked about barbiturates before when we talked about sedative hypnotics. Barbiturates, of course, they are not used anymore for the treatment of anxiety because of their highly addiction property. But they still have important clinical uses, as we have discussed before. The second group, which is the main, branch of our talk are the benzodiazepines. Benzodiazepines. Well, benzodiazepines are a very important group of drugs which are still, if they are used, probably they are still very effective and have a great value in treatment of certain neurotic illnesses. ولكن, like any other drugs, there are certain precautions. Okay? Yep, these are the sedative, hypnotic, anxiolytics. Another group which have only anxiolytic effect without sedation or hypnosis includes a group known as azabirons. Azabirons, like buzzbiron, like ipsabiron, as we will mention in a few minutes, they are anxiolytic drugs without producing any sedation or hypnosis. Okay? These are known as well as non-benzodiazepines. Okay? They are not benzodiazepine in structure. The third group, they are non-sedative, non-hypnotic. They are not anxiolytic, but they can reduce the symptom of anxiety, like beta blockers. Beta blocker is not anxiolytic by its own, but it can decrease the symptoms of anxiety. Yet these are the anxiolytics. Anxiolytics drugs which are used to reduce anxiety, the feeling of fear and apprehension. They were known as minor tranquilizers. They include the sedative hypnotics, anxiolytics, like oral barbiturates, which has no place in therapy anymore as anxiolytic, and the benzodiazepines, which are still provide a very good tool if they are used properly. And as well, second group, anxiolytics without sedation, like azaviron, and lastly, beta blockers. So first, we'll talk about the benzodiazepines. This is the most important group, and we are going to discuss them, inshallah, in details. The benzodiazepines. So why they are known as benzodiazepines? As we can see, this is the structure of a benzodiazepine. This is the main structure of benzodiazepines. The name itself, it is divided into three portions: benzodiazepines. This benzo, the first, it belongs to the benzyl ring, which is fused to the ring system. So this is the ring system of 7 atoms fused to benzene. This is the first name, benzo. Diaz means the ring system. It has 2 nitrogen atoms. The ring system has 2 nitrogen atoms. Ebenes indicates 7 numbered ring. This is the 7 numbered ring containing 2 nitrogen. Okay? And this is where the name comes from, benzodiazepines. Usually, as well, they are known as 1,4-benzodiazepines, because usually counting a nitrogen atom is at position 1 and position 4. So that's why they are known as 1,4-benzodiazepines. Usually, benzodiazepines, they have substitution at the nitrogen atom, and this substitution, which is usually an alkyl substitution, is necessary for the pharmacological action. Also, substitution at position 5, the substitution at the position 5 is essential for the pharmacological effect. Usually, this substitution is by a phenyl group. So this why they are known as benzodiazepines. So the benzodiazepines, how they differ from each other? The benzodiazepines, they differ from each other in 2 major properties. The first, in the pharmacokinetic property, as we will see, for pharmacokinetic property. Also, they differ slightly. In the pharmacodynamic property. Pharmacokinetic property, they differ in different property, including lipophilicity, the ability to dissolve in lipid. They differ in the half-life time, which is known as T-half. Also, they differ in their metabolites. Some of them, they are prodrugs. They are metabolized to an active drug. Okay, so these are some of the pharmacokinetic differences between different benzodiazepines that we will discuss, inshallah, in details. The pharmacodynamic property, they differ in potency, some of them highly potent potency, and as well they differ in efficacy. They differ in efficacy, the ability to produce the maximum possible effect. So as we will see, some of them they act as a full agonist, some of them they will act as an antagonist. Okay, we have discussed the difference between potency and efficacy when we talked about general pharmacology. So now these are the difference between different benzodiazepines. So how the benzodiazepines differ in their pharmacokinetic properties. As we know before, the pharmacokinetic process involves four steps. First, the absorption of the drug from the site of administration. Second, it involves distribution of the drug to different body organs, including the site of action. Then it involves metabolism in cases of highly lipophilic drugs. And lastly, excretion, mainly through the kidney, renal excretion. And we have said that both metabolism and excretion are known as elimination. That means the faster the metabolism or excretion, the faster the elimination of the drug out of the body. So the absorption rate from the site of administration depends on the lipid solubility. Depends on lipid solubility. The higher the lipid solubility, which is known as lipophilicity. Lipophilicity. The higher the lipid solubility, the higher the lipophilicity, and therefore the higher is the rate of absorption. For example, diazepam, it has a high lipid solubility, and therefore it is fastly absorbed. Once the benzodiazepine is absorbed, it will be distributed to different body organs. With the degree of distribution as well will depend on the lipid solubility. The higher the lipid solubility, the higher the degree of distribution, and the faster the rate it enters the brain. If it has high lipid solubility, that means it will enter the brain fast, and this will reduce what's known as fast on, fast off phenomena. Okay? Once they are distributed, benzodiazepines will be metabolized according to their polarity. If they have a high lipid solubility, they will be metabolized by oxidation in the liver. So highly lipophilic benzodiazepines will be oxidized in the liver first. Then it will be conjugated. If the first is oxidation, second will be conjugation. Okay? Of course, this will depend on the lipid solubility. If the drug has high lipid solubility, it will be oxidized first to convert it to highly polar compound. which can be excreted through the kidney, and then will be conjugation by conjugation with different organs. The oxidation process is age dependent. فالold people usually they have slow oxidation. That means the rate of elimination will be slow, while the conjugation is not affected by age. That is the same. Drugs which are excreted by conjugation usually they can be given to old people safely. Okay. Then the conjugated metabolite will be excreted through the kidney. Okay. So this is the first, the pharmacokinetic properties, the general pharmacokinetic properties of the benzodiazepines. Of course, degree of elimination is determined by what's known as half-life time, as we have discussed before. Half-life time, which is known as well as T-half, which is known as T-half. So how the benzodiazepines differ in their T-half? How they differ in their T-half? So how the benzodiazepines differ from each other in terms of half-life time, which is known as T-half. We said that T-half is an indication of a rate of elimination. Where the shorter the T-half means fast elimination, and vice versa. Long T-half means slow elimination of the drug from the body. So this is the half-life time. Half-life time, as I have said, indicates again a rate of elimination. The shorter the half-life, the faster is the rate elimination, and vice versa. The longer the T-half, the slower is the rate of elimination, okay? Now, if we apply that to the benzodiazepines, what we will see? So benzodiazepines, they are classified according to their T-half into first short-acting benzodiazepines. Short-acting, that means their T-half or half-life time is less than 24 hours. There are many important examples in this group, including, for example, midazolam. Just I will mention the most important and most famous because of the large number available in the market nowadays. So there is midazolam, there is temazepam, there is triazolam, very famous. There is alprazolam. The second group are the intermediate acting benzodiazepines. And intermediate, that means their T-half is more than 24 hours and less than 48 hours. This includes very famous examples like nitrazepam, like loprazolam, like clonazepam. These are the most famous examples. A third group, they are the long-acting benzodiazepines. Long-acting means that their T-half is longer than 48 hours. This includes very famous examples like diazepam, like florazepam, like bromazepam, and many others. So this is how the benzodiazepines differs in their T-half. What's the clinical importance of the difference in the T-half? The clinical importance is that the longer the T-half, the more is the accumulation in the body. That means the drug will be accumulated more in the body. That means the drug will stay longer in the body. And this means more side effect. Suppose that the person takes the drug at night before going to bed, for example. When he wakes up in the morning, if the drug has a longer T-half and more accumulation in the body, the person will suffer from a hangover effect. That means the effect of the drug will be retained in the morning. So this is the clinical significance of the T-half. The longer the T-half, the more the accumulation of the drug in the body, and therefore the more possible side effects and hangover. So this is the differences in the pharmacokinetic properties of the different benzodiazepines. So in summary of today's presentation, we talked about different types of treatment of neurotic illnesses, including antidepressant. The details of the antidepressants, inshallah, we'll talk about them when we talk about drug treatment of depression. We said antipsychotics are used as well in certain cases of neurotic illness, and the most important groups are the anxiolytics. We have classified in anxiolytics, drugs which relieve anxiety, into benzodiazepine anxiolytics and non-benzodiazepine anxiolytics. We talked about the pharmacokinetic of benzodiazepines in details, how they differ in their lipophilicity, how they differ in their T-half, and how they differ in their metabolism. Some of them, we have said that they are metabolized to active metabolite. So this is all about today's presentation. I hope that you enjoyed this presentation, and I hope to see you again on our next presentation, where we talk about the pharmacodynamics of the benzodiazepines. Pharmacodynamics of the benzodiazepines. I say Assalamu alaikum wa rahmatullah wa barakatuh. شكرا لكم على حسن الاستماع. الرجاء لا تنسوا الاشتراك في القناة، الإعجاب، التعليق والمشاركة مع الزملاء. دمتم بخير وعافية، والسلام عليكم ورحمة الله.